Hello. So today we're going to talk about sleep. Sleep is one of the pillars of lifestyle medicine because it is so incredibly important. We know that optimal sleep and restorative sleep make us feel better. But to understand the importance, I wanted to look at some of the evidence base in and around the sleep requirements and also the treatment of things like insomnia. So we think that adults between the ages of 18 and 64 years require about 7 to 9 hours per night. And that's coming from the Academy of Sleep Medicine in America. But it also aligns with Sleep Research Society. Older adults over the age of 65 require a little less sleep, around about 7 to 8 hours. But individual variability exists. So it's not all about the length of time you spend sleeping, but it's about the quality of sleep you get too. Certainly in my practice, I see insomnia and I see people who are tired all the time. And when you look at their sleep data, often they are going to bed really early because they're exhausted and then not getting a good quality of sleep because they've gone to bed too early. And likewise, we have people who are in a routine of getting up very early, but perhaps haven't gotten into a routine of getting to bed early enough. Now, there's two ways of looking at this. There are, in people's mind, they feel that they need to have a set bedtime. Sometimes it's more that getting to bed on time is a reassurance to them. And sometimes there's underlying problems that are going on that need to be explored. Things like depression, anxiety, sleep apnea, restless legs. So in this introduction today, we'll talk briefly about these things, but later on, if need be, there is a 6-week course on sleep and improving your sleep quality. So the consequences of inadequate sleep fairly long and reaching. There's an increase in cardiovascular disease, diabetes, obesity, and of course, mental health issues. But if you're not having enough sleep, you will have impaired cognitive function. Your decision making isn't quite so smart. But you also have less motivation for the other things that we want to do in life, exercise, social interaction. So even decision-making in and around food and so forth are affected by inadequate sleep. There is suggestion as well that your immune system is decreased and you have increased inflammation when your sleep is inadequate. So what makes good sleep? Good sleep to me is regular sleep schedule, going to bed at the same time, waking up at the same time, with a few variabilities when it comes to special circumstances. But you need a healthy sleep environment, cool, dark and quiet. Avoiding stimulants like coffee and alcohol and heavy meals before bedtime. This will prepare you for a good night's sleep. What about those who can't sleep? Insomnia. Insomnia is almost a vicious circle. Patients will often tell me that they struggle with insomnia, they can't sleep without sleeping tablets, or they just don't sleep, or I've got terrible sleep, or I only get 4 hours sleep. This is very, very common. But chronic insomnia does become a vicious circle insofar as if you can't get to sleep, you then worry about you not getting to sleep because of the knock-on effects the next day. And then next day when you're tired, you go to bed exhausted, concerned that you will not sleep. So it becomes a very cognitive-driven process also. And therefore, sometimes using a bit more of a multi-pronged approach is required. Sometimes it's using behavioural therapy. Sometimes it's using pharmacological strategies, but less and less requirement of that. But lifestyle modifications is huge in this area. So cognitive behavioural therapy for insomnia has become the gold standard of treatment. And that involves quite a lengthy process, but with good outcomes. Now, sleep restriction is part of that, which might be almost counterintuitive, given that you have a complaint of not enough sleep. But sleep restriction therapy is about reducing the time in bed to improve the time efficiency or the sleep efficiency. So if you're someone who's complaining, I'm only sleeping for 5 hours, but you're going to bed at 10 o'clock at night, the sleep restriction is either about you going to bed later, but remaining an early riser. And that sleep restriction is changed gradually to give you a normal bedtime. So sleep restriction we will talk about in the 6-week course as well. But initially, it's worth bearing in mind, if you're someone who is struggling with insomnia, perhaps just making your bedtime a little bit later. Then, stimulus control. It's about associating your bed with only sleep. If you've got chronic insomnia, your bedroom has to become only a sleep environment. That means removing everything else from the bedroom. That's no phones, no television, no sex, no eating. That's no dressing. It's everything comes out of the bedroom. And the bedroom is one cold, dark place to go to relax and to sleep. We need to talk then about cognitive restructuring, addressing your negative thoughts about sleep. When you have a bad relationship with sleep, you therefore have an angry relationship with sleep. If it's not restorative, you resent it. And we need to change that behaviour. We have to change that thought process. And that's done through cognitive behavioural therapy. Now, there are some really good resources, and I'll add them into the reading, for online cognitive behavioural therapy around sleep. And then a really important aspect of treating insomnia is relaxation techniques. Not everybody wants to do this, but it is about learning those deep breathing exercises and the progressive muscle relaxation. So often in its sort of most simple form, it is that body scan of starting with your toes and tensing and relaxing, working up through your feet, into your ankles, and also then into your calves, into your knees, into your thighs, into the buttocks, into the hips and the stomach and the low back. And it's tensing and relaxing. And big deep breaths to extend the chest and relaxing. And we do that all the way through fingertips, wrists. And we do that all the way up into our eyes and our face where we're tensing and relaxing. Deep breathing. Now all of this goes hand in hand with all the basic sleep hygiene education. And I have included a sleep hygiene cheat sheet at the end of today's reading and journaling. And what I need you to do is be honest with yourself around your sleep so that we can really effectively reduce sleep latency, improve your quality, and have a long-term benefit. I've also included 10-minute sleep relaxation audio clip at the end of today's module. And that's something I would like you to start using if you're someone struggling with sleep. Now, we have to mention the pharmacological interventions. So there's almost no good sleep medications. Whilst they can work in the short term and can be effective in the short term, they have an incredibly high risk of dependency, withdrawal issues, but also increasing requirements. So you plateau on them. So bearing in mind that benzodiazepines, melatonins or circadian, these are short-term effects, but only short-term, not recommended for long-term, and you'll regret the use of them. However, for example, in an acute situational crisis, a life sort of redefining moment, things like a terrible grief, a huge trauma, sometimes we can use them to break the cycle of an acute insomnia. However, lifestyle modifications, behavioural changes are far more useful in the longer term. So lifestyle measures, and that's where all of our 6 pillars come in. Regular physical activity. We know that increasing your physical activity will improve your sleep latency, so getting off to sleep, and your quality. Stress management techniques, mindfulness, meditation, and yoga have been shown to have positive impacts. Dietary modifications, avoiding stimulants and heavy meals in the evening. So alcohol, although it relaxes people in some ways, it's actually a stimulant and a depressant. So avoiding alcohol is useful if you're someone who's battling with insomnia. And there are some emerging therapies, things like bright light therapy, if that's effective for circadian rhythm disorders, so if you're a traveller or a night shift worker. And as I mentioned, digital or online CBT programs. These are accessible, and we'll give you some links to them as well. But it is essential, as I mentioned at the beginning, to rule out other conditions that might be at play here. Sleep apnea, depression, restless leg syndromes. So just making sure that there's not one of those going around. And let's not forget menopause and perimenopause. Menopause and perimenopause can play havoc with your sleep. Hot flushes at night time can be incredibly disturbing. So again, checking in with your GP and having a look at the other possibilities are really important. And your doctor will be delighted if you go in saying, I've got insomnia, but I'm wondering if it's something else, or I've got insomnia and I want to do the right things. I want to do the lifestyle measures. So the evidence base for this. Cognitive behavioural therapy is the most robust evidence. Lifestyle interventions required. We need to be looking at the whole picture of why we are sleeping. Why do we need to get to sleep? Are we exhausted? Are we depressed? Or is it genuine that this is our time of rest? Why are you going to bed early? Is it because you're fed up with your day? So the key takeaways today are your optimal sleep is between that 7 and 9 hours for adults. Chronic insomnia requires a real tailored approach. Cognitive behavioural therapy, lifestyle interventions. So improve your sleep with a bigger picture approach. Look at your environment, look at your behaviour and your relationship with your sleep. Look at your medications. Is there something there that we need to address? I will pop some references and some links, and we will get ourselves sleeping better. Thank you.